Despite the latest surge in COVID-19 infections, Florida schools will remain open.
That is the mandate from Governor Ron DeSantis, who says he based his decision on scientific data. Tonight, we are digging into the numbers to reveal how the virus really is impacting children. News 6 investigator Mike DeForest joins us now. So, Mike, what did you discover?
Well, Lisa, COVID-19 is absolutely impacting children. Now, there was concern that once school started and kids started going back, that the infection rates would rise, and they have, but hospitalizations remain low, suggesting children are much more resilient than us adults.
Take this down.
When deciding whether to allow her second-grade daughter to resume in-person learning, Lina Aravis was reluctant.
I was scared, very, very scared at first because, that's her getting sick. That's like crazy. But then after I saw that so many people weren't getting sick, I was like, let me just go ahead and put her back in school.
Her observation is supported by data from the Florida Department of Health. Of the roughly 1 million Floridians who have contracted COVID-19, only about 93,000 are children ages 0 through 17. In other words, kids make up about 9% of Florida's COVID cases, even though that age group represents 20% of the state's population.
Closing schools due to coronavirus is probably the biggest public health blunder in modern American history.
This week, Governor Ron DeSantis vowed to keep schools open, arguing that closing schools does little to stop the spread. Here's what the data shows. In early August, just before the school year began, there was a relatively high number of pediatric COVID cases each week. The numbers tapered off in September and October, but then started growing again in recent weeks. But that growth may not necessarily be tied to schools. These are the state's total COVID infection numbers, including adults, for that same time period. As you can see, the number of pediatric COVID cases we just showed you closely resembles the ups and downs of the overall population. Dr. Victor Herrera is an infectious disease specialist at Advent Health Orlando.
Since the beginning, we've seen that those in the age group between 1 and 17 tend to have a lower risk of infection and lower risk of hospitalizations as well.
When it comes to hospitalizations, the data shows the greatest number of kids going to the hospital for COVID occurred in early August, before school resumed. Since then, the numbers dropped and then leveled off, with just 20 children admitted to hospitals statewide last week. Hospitalizations have not been going up significantly, suggesting most children are not getting severely ill, but there are exceptions.
Children can still have serious manifestations from COVID-19. So even if the numbers are lower, it's important to know the importance of also following all the precautions when it comes to children.
Now, we wanted to see how COVID was impacting children of different ages. Those who are 1 year old or younger have the least likely chance of getting infected. Those age 14 to 17, in other words, high schoolers, are getting infected the most. The 5 to 10-year-olds about in the middle. Now, sadly, 9 children have died in Florida from COVID, but statistically, that figure is still very small.
Very interesting. And certainly, Mike, as a parent, it's something we've all been focused on and very concerned about.